The duration is of 12 weeks or more than that. So this is a picture showing healthy sinus and sinusitis. In the case of sinusitis, you can see inflamed sinus lining, whereas on the other side, it's perfectly normal. Excess mucus secretion or sinus infection can be seen on the affected side. The etiology of maxillary sinusitis: mostly it is due to infection, which can be due to periapical abscess spreading into maxillary sinus, fungal sinusitis, ciliary dysfunction, trauma, fracture of antral floor, allergy, tumors or cyst, antral communication and fistula, displaced tooth or tooth root, overextension of dental materials like gutta percha or cements or sealers. The signs and symptoms of maxillary sinusitis are impairment of sense of smell, foul smelling of mucopurulent discharge in nasal cavity, herniation of polyp into middle meatus, prolapse of polyp through the fistula, facial pain or pressure, facial fullness, nasal obstruction, headache, fever, halitosis, and ear pain and cough may be encountered in some cases. Now the treatment line will be: first we will treat the cause, plenty of fluids and bed rest will be given to the patient, maintenance of oral hygiene, antimicrobial therapy, nasal drops or sprays are advised, analgesics and inflammatory drugs are prescribed. Next is oro-antral communication. Communication between the maxillary sinus and the oral cavity is termed as oro-antral communication. It is one of the complications which can occur when doing extraction of upper molars. This is a picture showing oro-antral communication. In the first case, it is on the maxillary region, and in the second case, it is on the labial surface of the maxilla. Now, the etiology of oro-antral communication. Tooth extraction was the most common etiological factor. Maxillary molars, roots in close proximity to the maxillary sinus, destruction of the portion by the periapical lesion, little or no bone between the maxillary sinus or tooth, plunging an elevator through the bony floor during the root tip removal can be the cause, forcing root tips or tooth into the sinus, penetration while exposing impacted tooth, perforation during incorrect curettage, fracture of any segment of the alveolar process containing one or many teeth with tearing of the floor of antrum can be the cause. These are the radiograph and picture showing close proximity of periapical lesion to the maxillary sinus floor, which increases the risk of oro-antral communication during debridement of socket. In the first case, the roots of molars are in very close proximity to the floor of sinus. The symptoms are the 5 E's, which describe escape of fluids, epistaxis, which is unilateral most commonly, escape of air, enhanced column of air, or the excruciating pain. The 5 P's are pain, which is mostly encountered in infraorbital region, persistent purulent nasal discharge from the affected nostril, especially when the head is lowered down, post-nasal drip, that is the trickling of nasal discharge from the posterior nares down the pharynx, popping of antral pathology orally, and phonation problems. The tests: tell the patient to fill his mouth with colored water. Colored water we prepare with water mixed with few drops of gentian violet and let him bend forward and downward. If there is an oral antral communication, it will flow through the nose. If communication exists, there will be passage of air through the tooth socket and bubbling of blood in socket on blowing air. Now the prevention. Firstly, radiographic examination of the region surrounding the tooth to be extracted. That is specially advised in cases of maxillary molars. Careful manipulation with the instruments, especially during the luxation of the root tip of a maxillary posterior tooth. avoiding luxation of the root tip if visualization of the area is hindered by hemorrhage, careful debridement of the periapical lesions that are close to the maxillary sinus. The management part is, if the communication is 2 mm or less, if the communication is 2 to 6 mm in diameter, and if the communication is larger, that is 7 mm or more. In the first case, there will be no surgical treatment. We'll just ensure the formation of high quality blood clot and will advise sinus precautions. In the second case, when the communication is 2 to 6 mm in diameter, will ensure the maintenance of blood clot. Figure of 8 suturing will be done over the socket, will advise the sinus precautions, and antibiotics, that is amoxicillin or clindamycin, will be prescribed, will put the patient on follow-up. When the communication is 7 mm or more in diameter, surgeon should consider having sinus communication repaired with the flap procedures. Flap can be local or distant, which will be discussed in detail. Most common for small opening, that is buccal flap or palatal flap. The sinus precautions that we advise to the patient are: the patient should not drink with straw, do not blow through nose, use all the medications as directed by the surgeon, do not play any wind instruments which requires additional pressure, do not smoke cigarettes, pipes, cigars, do not sneeze through your nose, avoid swimming or any strenuous exercise for at least 1 week, eat soft diet and chew from opposite side, rinse 3 times a day with warm water. It's not uncommon to have a slight amount of bleeding from nose for several days. The next complication is oroantral fistula. If an oral antral communication is not treated, this can become lined with epithelium. Hence, an oral antral fistula is an epithelialized tract linking the maxillary sinus to the oral cavity. It's the chronic version of the acute communication of the maxillary sinus into the oral cavity. It facilitates the regurgitation of fluids from the oral cavity into the maxillary sinus and contamination of the sinus with the oral microbial flora, which leads to chronic sinusitis. This is the clinical picture showing an oroantral fistula. In the first case, it is on the maxillary ridge, and in the second picture, metallic probe is inserted inside the fistula. Temporary therapeutic measures before the surgical closure includes Whitehead's varnish pack. The pack is used over a socket and secured with suture. Whitehead's varnish composition is benzoin, storax, balsam of Tolu, iodoform, solvent ether.